Jay Foster began chiropractic care because of some shoulder and back pain that he had been having 5 years previously. As he was in the chiropractic office one day, he noticed some information on cold laser therapy. He was also having some knee problems that kept him from doing things he enjoyed, such as biking and hiking. So he decided he wanted to try cold laser therapy. After receiving treatments of cold laser therapy as well as chiropractic care, he was able to get rid of his lower back pain and a lot of the pain in his knees. There are a lot of people like Jay Foster who come into your office each day seeking for their pains and aches and ailments to go away. All these people, or some of these people, can be benefited by cold laser therapy, which enhances the natural process in the body. I've been researching cold laser therapy for the past 4 weeks and have been familiarizing myself with the answers to the following questions. How does cold laser therapy work? What conditions is cold laser therapy effective for? Who should avoid cold laser therapy use? Cost and features of portable versus non-portable devices, as well as what are the top brands comparisons. So how does cold laser therapy work? As the cold laser is placed over the injured area of the body, the light energy is absorbed into the cells of the body, and this stimulates the natural healing process in the cells, which reduces pain, increases blood flow, and stimulates the healing process, or the repair of the tissue. This is a image of cold lasers in use, a class 3 laser and a class 4 laser. And I'll talk more about classes later. Cold laser therapy is similar to photosynthesis in that the light energy is absorbed into the plant and then it creates a chemical energy. Cold lasers work pretty simply. You turn the cold laser on and you choose settings. Some of the settings have continuous penetration while others are pulsed. There are also, the penetration depends on the class of the laser. 3 and 4 classes are usually what practitioners and chiropractors use in their offices because it has a higher wattage, which allows more penetration. Cold laser therapy can be used for many conditions, some of which are headaches, lower back pain, tendinitis, carpal tunnel syndrome, and even disc herniation. There's a story in the video that I'm going to show you about someone who was able to find relief through cold laser therapy who had disc herniation.
To see patients who are scheduled for surgeries, especially those who will develop some severe open infected lesions, will be at risk of losing their extremities to amputations, to see them walking away on their feet, on their legs, without any disabling surgeries. One of the stories, a naturopathic physician who was diagnosed with multi-level disc herniations in her lumbar spine, and she's been suffering from low back pain for over 20 years. So the first time I met her, she was a patient, obviously. And after a successful treatment course with a laser, she was pain-free, she was functional, she was back to her practice full-time. Plus, she decided to bring that technology into her office because she realized laser stimulation, photostimulation, can become an organic part of this natural healing. So it will not really contribute with the philosophy of naturopathic medicine. And now she is helping dozens of other patients like herself.
This is just one example of how cold laser therapy can be an advantage and how it can help people lose their pain. There are also some disadvantages of cold laser therapy, and some of those include multiple treatments. Usually between 8 and 30 is the average, and many times 2 to 4 treatments a week is necessary. Sometimes old injuries can be aggravated by the cold laser therapy, but usually this subsides within a few days and isn't much of a problem. When I came to your office in 2012 for chiropractic care for my neck, I came once a week for a couple months, and then it switched down to once every other week as I got better. And this was kind of time consuming for me because I had a 3-month-old, and I also was taking online courses. But for me, because I received such great care and I was receiving benefits that I knew I was feeling better, I kept coming back for more. I assume that this is the same case that takes place with those who receive cold laser therapy. Even though they may have to have 8 to 30 treatments, they see the benefit and they want to keep coming back for more. Those who should avoid cold laser therapy are those who have cancer or suspicions of cancer or carcinoma. Also those who are pregnant, because it is still unknown how it affects the fetus. Children should also avoid cold laser therapy because they're still growing, and they should especially not have cold laser therapy over their bone growth plates. It's also a debate whether or not those with diabetes or those with pacemakers should use cold laser therapy or not. According to practicalpainmanagement.com, it's a misconception that pacemakers are contraindicated for cold laser therapy. And this is because the pacemakers are encased in metal and can't be affected by the photons of light. However, if the laser has an electrical stimulation that it uses, then that's when those with pacemakers should avoid cold laser therapy. There are so many models and different types of cold lasers that it would be hard for me to give you all the costs and the features of all the portable and non-portable ones, as well as all the top brands, because there are so many. So I am going to give you a handout afterwards that will give you a comparison chart that will allow you to see the features and costs, and will allow you to make a judgment. I also have provided on that sheet some resources that you can look up that will allow you to see summaries of these different cold lasers. So as I was researching the brands that you mentioned, I realized that Multiradiance is actually a medical technology company. So it's not an actual brand of cold lasers. However, TerraQuant is, and it is a product of Multiradiance. Zerona is also not a cold laser brand, but is actually a procedure used with cold lasers. So I'm going to give you some information that will help you to choose a cold laser. If you know top brands, it's only going to do you so much if you don't know what type of laser you need. So according to Alex Harris, a consumer product advisor for the alternative health market, he says that if you cannot test a product first, then you shouldn't buy it. There are so many companies out there scamming us and trying to tell us that their product is the best and that their product does this and their product does that. But there are so many companies that just want you to buy their product. Those companies that will not loan you their product first to see how you like it are the companies that are not as honest most of the time. If you loan a product and you like it, you're gonna buy it. But if you don't, then you're not. Alex Harris has a website, which is included on the handout, and he has a laser quiz that you can take that will help you to know what type of laser you need for your office, depending on the needs of your patients. Now, I've just gave you a lot of information, so I'm going to give you a little bit of a recap. 1. Cold lasers enhance the natural process of the body. 2. There are over 26 conditions that can be effective using cold laser therapy. 3. Those who are pregnant, have cancer, or are children should avoid use of cold laser therapy. There are disadvantages, but the advantages overpower the disadvantages. And never buy a laser if you can't test it first. Just like Jay Foster received benefits from cold laser therapy, your patients can too. I encourage you to research cold laser therapy using some of the resources that I've given you and apply those things and see if cold laser therapy is something that you should use in your office. Thank you.